as a young child, I was able to witness, doctors taking care of members of my family, and I was able to kind of see the impact they had on our family and my loved ones. And at that early age, I realized that, I wanted to be able to have that type of impact on a patient's life. Going back to the beginning of medical school, I knew I wanted to go into surgery, and I knew I wanted to work with kids. So those were kind of the two things that drove me in the direction towards pediatric urology. When they first come to see me on the first visit, I'll review their record. I'll kind of see what brings them in. I kind of get an understanding of their past history, and then I'll kind of just listen to them and see kind of what is most important to them, what has been bothering them the most, and then we'll kind of go from there and try to figure out what we can offer and how we can improve their quality of life. It's the whole family you're treating. It's you get the history from the parents oftentimes, and then you also kind of want to bring the child in as well and hear their perspective. But ultimately you want to learn from the entire family kind of what's going on, and then ultimately make sure everybody understands and is agreeable to the plan that you created, the treatment plan. As a parent myself, I know oftentimes the parent is carrying the most of the stress and the burden, and so it's very important to work with them closely. And anytime I'm caring for children, I'm thinking of my own children in the back of my head and kind of what kind of care I would want for them, and that's kind of what drives me every day. Most rewarding part is seeing a patient back after I've been working with them for a while, and they're happy and they're doing well. They've seen an improvement, either whether that was surgically or a lot of times not surgically, and either through medication or just monitoring and just kind of making that family feel more at ease after they've seen me that everything's going to be okay.